Okay, thank you so much. I'll stand because I'm tall. You can see I'm tall. Good morning. My name is Wycliffe Kitangala. That's my name, Kitangala. Wycliffe is another name. I'm the sub-county nutrition and dietetics coordinator, Nyando. Nyando is a sub-county, one of the sub-county in Kisumu County, one of the sub-county in Kisumu County, where we have the flood ambassador. I'll talk briefly about primary healthcare, which is a pillar in universal healthcare, universal health coverage. Remember Nyando, we got an opportunity to do pilot primary healthcare. We are among the 3 sub-county in Kenya. One was in Kajiado, the other one was in Embu, then in Kisumu we had Nyando. So basically, primary healthcare is just preventive medicine. You see, preventive medicine, so that we reduce the workload within our facilities and be able to take care of ourselves. Primary health care, we take care of ourselves. It starts from you. So during that period, we did and formed a multidisciplinary team, which composed of many professionals within health system. So, and it was rolled down in Nyando. To be specific now, I'll talk about nutrition. How is it improving or reducing the workload within the facility? I'll give a statement first. Remember, medicine, they come from plants. So, nutrition is, you can say it's ukuta. Usipojenga, usipoziba ufa vizuri, then ukuta itafanya nini? Itaporomoka. So, if you think, we say, if you think nutrition is not there, then you'll take medicine as part of your life. So take nutritious food as medicine from the word go, to prevent taking toxic pills as your medicine for your future. Remember, medicine are toxic, and that's why we have pharmacy and poison board. You take medicine excessively, or you take medicine in a different way, it's poisonous. But you take nutritious food, it's good medicine to your life. Now, I'll move to the programs that we are doing so that we prevent that workload within our facilities in Nyando. First, under nutrition, we have what we call BFCI. This BFCI is Baby Friendly Community Initiative. Previous years, we used to have hospital. We used to have baby hospital initiative, whereby you go to the hospital, people will talk about that. But now we are going to level 1. Level 1, the community level, so that we can have that base of prevention. Under that baby-friendly community initiative, which is part of primary health care, we work as a team from different stakeholders. We have what we call multi-sectoral network, whereby we work with people from agriculture, education, social protection, children department, judiciary, we work as a team so that, remember from the definition that we got it from Dr. Otieno, whereby health, you must be wholesome, spiritually, physical, socially, wholesome. Because that's why we have mental problem, because remember during the period of when we had a problem, that period that people didn't go to work, ilikuwa inaitwaje? Ukipatikana usiku ama bila mask, lockdown, So you see that period, people had developed mental problem. Why? Because nutrition, food security was not there. We used to just depend on maybe other things, but there was no nutrition diversification still. So during that period, watoto kama mimi niko na watoto 7 wanakaa kwa nyumba na hakuna chakula. Sio Mr. Dr. Otieno. Now I'll start thinking, and that period kuna some other thing that's taking place, napata mental problem. So under BFCI, Baby Friendly Community Initiative, we form what we call mother-to-mother support groups. Under that mother-to-mother support group, we have CHVs who are representing from the level 1. We have chairs. We have spiritual leaders. We have people from social protection. We call them social protection volunteers. Then we have child protection. We call them non-communicable diseases. For example, diabetes. Nowadays we are coming to diabetes obese. Yeah? You see somebody akona diabetes lakini yako obese. Now we call it diabetes obese. So remember that in Kisumu County, almost 80% people are overweight. So tukipima kilo yetu hapa sai, then tuchukue BMI, tutapata 80% of us are overweight. True? Sidio? Yes, 80% of us are overweight, maybe including me. So, and we need to do what? Prevention. Prevention. How do we do this prevention? We must eat nutritious and balanced diet. But you see, nowadays we don't talk about balanced diet because we realize that, you see, for laymen, when you talk about balanced diet, you can even go to the supermarket and say, you need a balanced diet. We talk about food groups. So when we talk about food groups, we say, now you need to have 10 food groups. So for a normal human being, you need from 10 food groups, you take at least 5. Then for a child, you take they have 7 food groups. For a normal child to grow well, they need to take at least 5 from the 7. We'll go back to, because we are prevention, that's primary health care. To reduce the workload, she said that, the workload in the hospitals, we don't have many physicians at the moment, so we don't need those to form clinics like diabetes clinic, medical clinics. You see, for those, you spend on a patient, one patient. Take for example COVID, when we used to have COVID, spending on a COVID patient was more than, ungeenda kama in a hospital, you can spend more than a million, sidio? But to prevent, how much do you spend? Nothing, sidio? So now we'll go, how do you prevent this? You start from, nyumba unaanza kujenga kutoka wapi? Foundation, si ndio? Kama uko Kano penye niko, si ndio? Ukijenga tu kileta fundi na chimbe round na weke agmwage changarawi na anza kujenga ile nyumba, you give it 3 months inaanguka, si ndio? You'll need a floating foundation. And that's why you need education. You talked about education, training, education. That's why you have Mother Kima. And we talk about 1,000 days. 1,000 days is our foundation. What do I mean? I mean maternal nutrition. Maternal nutrition means from the day you conceive to 2 years. That's 1,000 days. When you conceive today, you unahesabu after 2 years inafika 1,000 days. If you don't take care of good nutrition from that 0 day, from the conception date to 2 years, then already there is a disease, malnutrition disease we call stunting. Stunting does not necessarily means you become short to your, as per your age. Sio ukue mfupi kwa sababu ya, but stunting really, kama daktari will testify, somebody kama umai kuona x-ray ya somebody mwenye akona typical TB, tuna kitu kama mashimo, si ndio? So that's how somebody who stunted kwa brain yake ina form that we call them curvatures, na brain haitakani kukua hivyo. So already that child after 2 years you cannot prevent stunting. So that child will not perform economically, because even education wise, because to have that capacity to serve and have that economical status, then also you need to have education which is a spar. Awezi anzisha kitu aendelee, and the majority of them then they'll have to abuse drugs. Those people who are stunted, because stunting means that child hakuwa receive good nutrition, and apart from that nutrition, socially, you see, mtoto mama akikuwa mjamzito, from the word zero, hata ukiwekea mtoto a good music anasikia mzuri kwa tumbo, si ndio? You stress the mother, that child anakuwa stressed up. So sasa huyo mtoto mentally atazaliwa akiwa akona mental problem. And that's why sometime unaweza pata mtoto mwenye akona 1 year, then unaambiwa this child akona stress. Unashindwa mtoto anaweza kuaje na stress, si ndio daktari? Then ask yourself, this child wakati that conception hakupata good nutrition, hakupata stunting, na hakupata social health iko kuwa mzuri during that period. Because even you today, when I give you good food, you will need good environment. That's why we have social protection. To take that food, you'll need wash, because you can take food and develop cholera, or vice versa. You can eat meat and upate anthrax, ile njapimo, si ndio? So you'll need good nutrition. Take from the word go up to 2 years. That's why iko kadi. Ukisoma kadi, hiyo kadi, I think most of us went through that card. Ukiangalia ya mtoto utaona kuna pali imepaintiwa from 0 to 2 years imewekwa red. It means you cannot correct stunting. You can correct within that period, but from there you can't. That child will be a garbage. I'm sorry to say, to use that word, but that child will not perform in any field. Ni kama sasa utakuwa una push mawe itoe maji. So nutrition is the key.
Thank
the other thing,
thank you.
No, I'll just talk lastly.
Okay.
Lastly,
Okay.
In Nyando, we have introduced what we call family work. Family work in Kadibu. I think all CHVs have been trained. Yes. The mother take the middle upper arm circumference of the child. Akiona ni red, anapigia CHV simu ama anarifaa mwenyewe tena. Akiona ni yellow, anafanya nini? Ana refer. That's prevention from the community level, and that's the program we have in Nyando, so that we are able to boast of Nyando, a primary health sub-county. Thank you.